doing a hip replacement going in through the front of the hip, and by doing that there is a natural muscle plane where we're able to pull the muscles apart to get access to the hip joint for a hip replacement, as opposed to cutting through some of the biggest muscles in the body. So you can imagine, by not having to cut through very large muscles, those muscles then don't have to heal, so that allows for a much quicker recovery. Patients require less pain medication, which they really like. They're getting off assisted devices, whether it's a walker or a cane, much quicker, and they're able to get back to the activities that they enjoy at a much faster rate. First, need to have an appropriate diagnosis for why you're having hip pain. Frequently, patients are scared or timid to come in to an orthopedic surgeon because they think they're coming to have surgery. But 70 to 80% of our practice actually involves not operating and treating patients with non-operative management, whether it's physical therapy, activity modification, weight loss programs, medication like anti-inflammatories. Quite frequently, we're able to get the pain under control, restore patients' function and mobility without surgery. So if anybody's doing research or think that they're having hip problems, the first step would be to get in to see an orthopedic surgeon to have a dedicated evaluation. Typically we start with x-rays, physical exam, and a history, and then at that point we would make a determination if surgery was a necessity. But typically the surgeries are done in the morning. That day we get the patients up, get them walking. I always tell my patients, in the morning you're going to make me work hard by doing the surgery, and then I'm going to start making you work hard with the recovery. But typically are using a walker with assistance for the first few days. Most patients are staying for anywhere from 24 to 36 hours, but I would say 95% of patients are ready to leave the very next day. And usually you're on a walker for anywhere from 3 days to a week, and then you're transitioning to a cane. At about 4 weeks, most patients say they already feel at least back to normal, normal as in what the hip felt like in their activity level before surgery. At 6 months, they're doing almost everything that they would want to do.